Vitamin D is a fat-soluble vitamin that performs numerous functions, including promoting the mineralization process of bones, increasing intestinal absorption of calcium and phosphorus, strengthening the immune system, and promoting heart health. 10 to 20% of vitamin D comes from food, in particular from fatty fish, such as salmon, mackerel, herring, and sardines, from egg yolk and cod liver oil, as well as from some industrially manufactured foods, such as milk or breakfast cereals, to which vitamin D is added during the production phase. The remaining 80 to 90% of vitamin D needs come from a series of chemical reactions that are triggered following exposure of the skin to UVB sun rays, ultraviolet radiation responsible for our tan. Current studies indicate that approximately 1 billion people worldwide, of all ethnicities and age groups, are affected by a vitamin D deficiency, and approximately 50% of the population suffers from vitamin D insufficiency. A pandemic of hypovitaminosis D, which represents a serious public health problem worldwide, as it causes a series of negative health consequences, including rickets, osteomalacia, and osteoporosis. And according to some studies, it seems to favor the onset of autoimmune, cardiovascular diseases, neurological and respiratory, as well as tumors and type 1 and 2 diabetes. But when is it really necessary to take a vitamin D supplement? How should you take it? In what quantity and at what time of day? Let's try to answer all these questions. National and international guidelines recommend taking vitamin D in the following cases. In infants for the first 12 months of life, as they are not able to get enough from their diet or exposure to the sun. In adults in whom a vitamin D deficiency has been confirmed following a blood test. In all those patients hospitalized in residential care or long-term care facilities where exposure to sunlight is limited or absent. In pregnant and breastfeeding women, as the need for vitamin D increases, which is necessary to ensure adequate bone development of the fetus and for the maintenance of the maternal one. In people suffering from osteoporosis, as vitamin D counteracts the loss of bone mass and reduces the risk of fractures. As the Italian National Institute of Health reminds us, it is important to always contact your doctor before taking any vitamin D supplement. He will be the one to prescribe the type of drug to use, the dosages and methods of administration. When and how to take vitamin D. Research suggests that the best time to take vitamin D is during the most important meal of the day, better if with a high fat content. This is because vitamin D, being a fat-soluble vitamin, that is a type of vitamin that does not dissolve in water, but in fats, is better absorbed when consumed together with dietary fats. Extra virgin olive oil, for example, a cornerstone of the Mediterranean diet, is an excellent carrier that promotes the absorption of vitamin D. A study published in 2014 in the Journal of the Academy of Nutrition and Dietetics on a sample of 50 elderly men and women measured blood levels of vitamin D following the intake of a supplement during a meal with and without fats. The results showed that the mean plasma vitamin D level after 12 hours was 32% higher in subjects who consumed meals containing fat compared to those without fat. Based on what has been said and on the scientific studies available to date, there is no time of day considered better than others for taking vitamin D. Whether it is in the morning for breakfast, lunch, or dinner, makes no difference. The important thing is to combine it with a meal that contains some fat. How much vitamin D should you take? When we talk about vitamin D requirements, we express it in terms of adequate intake. This term indicates the average level of nutrients consumed daily by a healthy population, which is presumed to be adequate to satisfy the needs of that population. However, vitamin D doses are conventionally expressed in international units, a unit of measurement of the quantity of a substance based on its effect, that is, on its biological activity. However, there are conflicting opinions in the scientific community regarding the quantities of vitamin D to be taken. According to the European Food Safety Authority and the Italian Society of Human Nutrition, the level of adequate intake of vitamin D is 15 micrograms per day in healthy adults, equal to 600 international units, and 10 micrograms per day for infants up to 12 months of age, equal to 400 international units. According to the Endocrine Society, an international medical organization made up of over 18,000 endocrine researchers and doctors from more than 100 countries, the daily requirement of vitamin D in adults is 1,500 to 2,000 international units. The important thing, however, before taking any vitamin D supplement, it is important to always contact your doctor, avoiding do-it-yourself and reducing the risk of side effects. In recent years, there has been a notable increase in vitamin D consumption around the world. The increase in the incidence of hypovitaminosis D, partly due to the progressive aging of the population, and the ease with which it can be purchased online, have contributed to the continuous growth in vitamin D consumption. It is no coincidence that the size of the global vitamin D market will grow from $1.23 billion in 2021 to $2.4 billion by 2030.